our speakers today. I know I'm excited, and I think a lot of us are excited to hear about this topic. Definitely something that is needed in today's society, understudied, less focus, and it needs more. So here we are I'm going to turn it over to the folks at the National LGBT Cancer Network to talk about addressing the cancer burden in LGBTQ plus communities. Thank you for being here.
Thank you so much for that handoff, Christy. We are so honored and excited to be here with you all to talk about a topic that is important year-round, especially this year, as we continue to see the large number of anti-queer and trans legislation. And so we'll be talking about health equity topics, cancer inclusion, and we are really going to get down to really talking about some of the systems change work that's really needed to ensure that you're inclusive in all of your work. You can go to the next slide. It's a lovely picture of the three of us. So we'll each introduce ourselves. My name is Bryce Kahari. I'm the Training and Technical Assistance Manager here at the National LGBT Cancer Network. My background and bread and butter has kind of been tobacco control, and then joining this organization, now Cancer Inclusion. I am based in Mississippi, where we're pretty warm, so we can't relate to all of you folks in New York who are going through the snow. Hafsa and Noel can. But I'm really excited to be here and looking forward to this presentation. I'll pass it on over to Hafsa.
Hey everyone, good morning. Thank you for joining us today. My name is Hafsa. I'm a project associate here at the network. I've been here about 8 months. I am located in Detroit, and you can probably see in my Zoom background there, that's a beautiful picture of our skyline, but probably doesn't compare to New York's, but it's still pretty. We got Canada on the other side. So here's our agenda today for the next hour and a half. We'll start with an introduction about what we do here at the network, a quick review on LGBTQ plus identities, and then we'll discuss demographics, cancer, and barriers to access. And to top it off, we'll review our best and promising practices to help you implement these changes in your own organizations. And my colleague Noel here will be dropping links for us in the chat. The beautiful picture of some of us over this past summer at NICTO. So our mission here at the network is to educate our own communities about disparities in tobacco and cancer that affect our health and the importance of screenings. So we advocate for LGBTQ plus engagement within the mainstream cancer and tobacco world to make sure we're included. And we do as much training as we can to folks in public health and healthcare providers to make sure our communities are receiving quality care. So we are one of 8 disparity networks, part of CDC's Networking to Save program, which is intended to advance the prevention of tobacco use and cancer in populations that experience disparities in these realms. So our sibling networks are focused on different populations. So a few of those include rural populations, American Indian, Alaska Native populations, and Asian American and Pacific Islander communities. So we send out monthly newsletters with announcements, upcoming projects, special events, new resources, and we love to highlight the amazing work that our partner organizations are doing. And Noel will drop a link here in the chat for the link to join our newsletter. If you haven't already, Noel will drop a link again for an opportunity to join our network. Membership is completely free. So like this training, we offer training and technical assistance, opportunities to connect you with local LGBTQ plus organizations and other state health departments. And one of our specialties is creating tailored media and educational resources that allow you to add your logos and share amongst your networks. So this is some more information that we offer under the realm of training and technical assistance, headed by my colleague Bryce. So we have customized trainings and webinars, educational opportunities, and all of these things we'll update you in our monthly newsletter and on our website. So for level setting, we'll go through a quick review of LGBTQ plus identity and terminology, which are crucial to understand when you're working with LGBTQ plus communities. So what is the difference between sexual orientation and gender identity? Sexual orientation is a term that describes who you're attracted to and who you partner with. Sexual orientation is not a choice, but it's fixed and comes from deep inside of you. For some people, their sexual orientation can fluctuate throughout their life. Gender identity is your internal perception of your gender and how you label yourself. You may see yourself as male, female, a blend of both, or neither. Your gender identity can be the same or different than your sex assigned at birth. So our gender identity doesn't always match our appearance, our body, or others' perceptions of us. Transgender is an identity label for people who identify substantially different than the gender that they were assigned at birth. The gender binary is the idea that there are only two genders and that every person is one of those, male or female. But there are plenty of people out there whose gender does not align within this gender binary. They may identify as both male and female, somewhere in between, or they may not feel a connection to either. This term is called non-binary. So people can identify as non-binary regardless of how they look, how they express themselves, dress, or the pronouns that they use. You've probably noticed that more and more people are starting to display their pronouns in their Zoom names, their email signatures, Instagram, and maybe even registration forms when you're signing up for trainings. So sharing your pronouns helps cultivate an inclusive environment and show your respect for others. This slide details some tips for asking, sharing, and using others' pronouns respectfully. So some people don't identify with she, her, or her, him, he, him pronouns and may feel more comfortable using more gender-neutral pronouns such as they, them. And listen, we all make mistakes. It takes practice getting used to pronouns. The best thing that you can do is, if you mess up, is thank the person that's correcting you and quickly move on. And when you're telling your pronouns to someone, it's important to say my pronouns are she, her. Don't say my preferred pronouns. Say my pronouns. Now we'll do a quick poll here. And the way that this poll works is you can go to www.menti.com and enter this code, or I'll drop a link in the chat and you can join from your computer or you can join from your phone and answer our poll question. Great. Thank you for adding and sharing these terms with us. So I'll go through a few of these with the help of my colleagues, Noel and Bryce. So I'll start with, it looks like non-binary is a common one. So non-binary is someone who is an identity label for someone who doesn't identify within the male or female realm. So people who identify as non-binary can use any pronouns. They can use they, them, she, her, he, him. But it's a way to align yourself, outside of the binary. Pansexual is an identity label. It's a sexuality that is similar to bisexual and means that you are attracted to all gender identities. So typically someone who describes themselves as homosexual is attracted, or gay or lesbian is attracted to the same gender identity, and pansexual is used to describe any attraction to any gender identity.
And I can hop into Hafsa. Hey, everyone. So I see that queer is up there, and it's always a term that I feel like it's important to address. So it's really an umbrella term to describe folks that don't identify as straight and or cisgender. Now, cisgender is another term that you might hear tossed around. Basically, it means not trans. So again, historically, queer was a slur used to refer to someone who isn't straight or cisgender, used as a derogatory term, but it's been embraced in a lot of communities. And so sometimes when we say the word queer at our organization, we're meaning both lesbian, gay, bisexual, and so sexual and gender minorities kind of in one big term. So again, it's always best to ask and follow what community members are using. So some people feel comfortable using the term queer and other people it doesn't fit them well. But just the main takeaway for that word is that it is something that is sort of really describing people that are outside of outside of some binaries. And Bryce is dropping some links in the chat about gender fluid. And I see someone has demisexual up there. So that's, again, there's a lot of newer terms. And again, demisexual is someone that likes to feel a connection, maybe a more emotional connection before they are, sexually intimate with someone. So again, I think we can say that terms and definitions are always changing. People are creating new terms to feel connected and to build community and to feel seen. And so the takeaway isn't to memorize all of these things. The takeaway is to, feel comfortable asking questions and learning how to use terms that community members are using. So Bryce, anything you wanted to add before we moved on?
No, I think you and Hafsa both really said it. You are going to mess up. Just go ahead and get the process right now of knowing that you're gonna mess up. I'm queer, I'm in this community, and I'm still, messing up or not, there are terms that are new to me. And so one thing that we always say is Google is completely free, right? You also have a really great link that Hafsa dropped in the chat, like a queer terminology sheet. But in a few years, there are going to be words that we're going to use that are not going to even be on there. I think Noel said it best. As folks change, the words in which that we use to identify ourselves with are also going to change. So like I said, you're going to mess up. It's okay. A good tip is to mirror language back to folks. So if folks say, that this is how I identify, a really great thing to do is just mirror that back. And at the end of the day, as long as you are doing your best, we understand you're going to mess up. Again, I mess up a lot of times. And so just, give yourself grace, but also really show that you are trying to learn and you are trying to, get the terminology right.
All right, thank you, Noel and Bryce. I'll pass it on back over to Noel so that we can continue. And don't worry, we have time for a Q&A, and we have time for more poll questions at the end.
Bryce, I think you're doing these first few ones, right? Or no?
No, I think that's you. Oh, you know what? I'm sorry. I think that is me. My apologies. It's feeling like a Monday, even though it's a Tuesday. So you can go to the next slide. We have a question from Travis. So Travis, feel free to just drop your question in the chat, and we can answer it in the chat and also answer it at the end. So really want to just dive into, before we even start talking about, any of the topics that we're here to talk about with cancer inclusion, cancer barriers, we really wanted to just give a layout of what the queer community is looking like, especially in 2023, according to a Gallup poll that was released last year. We now know that 7.1% of Americans identify as LGBTQ+. And so as you can see by this line graph, that number has really expanded over the past decade. It's actually doubled. And that is really due to a lot of factors. We know one is really the increased visibility and representation in media, and in events is a huge one. Being able to see folks, that look like us, seeing folks that identify as we do, having that picture and that representation in the media means that so much of our community now feels comfortable being open. We know there are still, of course, a lot of barriers. You can go to the next slide. Another reason why we're seeing a huge increase, of queer folks is really my generation, Gen Z. So roughly 21% of Gen Z Americans, that's, folks who were born between 1997 and 2003, those who've reached adulthood now, identify as LGBT, and that's double the proportion of millennials who do so. And of course, that's much more, as you look at previous generations. I also wanted to make a note, just because I'm sure that you all are hearing us use different terms: queer, LGBT, LGBTQ plus, LGBTQIA plus. So I just wanted to do just a quick kind of naming of that. So especially when we're talking about data, sometimes we don't have data for the full LGBTQ plus community. Sometimes we have data on the LGBT community or even the LGB community. A lot of times, unfortunately, especially previously, trans communities were just not studied. There was not an understanding that our community was as diverse and wide as it should, that it includes the intersex community, that it includes queer or questioning folks. And so if you hear like us, kind of use different terminology, know that we prefer using LGBTQ plus or LGBTQIA plus, and queer is fine as well. But whenever we cite LGBT or LGB, we're citing that because that's what the data supports. But yeah, we're really excited that we're seeing such an increase in folks who feel comfortable being themselves. We know that the population is changing faster than ever, and we know that our community is really it's really a growing force, both in the US and around the world. And, I've often heard folks say, like, why does it seem like, that there's just like, so many folks are now identifying as queer, back 10, 20, 30 years ago, that wasn't the case. And, what I always say is, we've always been here as queer folks. There have always been a lot of us. We're just now seeing that we're able to be in a society that is more accepting, that is more welcoming, but we still have a long way to go. And the last point that I really want to highlight on this slide is just a takeaway from that Gallup poll, is really that young adults in particular are really feeling more empowered to claim their identities. And you're going to get left behind if you're not updating, if you're not improving, and if you're not ensuring that you and the work that you do is inclusive. You can go to the next slide. So we can't talk about health equity, we can't talk about even the queer community without talking about BIPOC folks. That's Black, Indigenous, people of color. It's really important in our work that we talk about intersectionality. We know that a quarter of the US population is BIPOC. And so for the queer community, about 42% of our population actually identifies as BIPOC, which pretty much doubles that number. And so if you look at us as a group, we are really such a diverse group of people, even more diverse than the general population of the US. And so it really just reminds us that in all of the work that we do, that we are layering intersectionality. You can go to the next slide. Kind of keeping on the same vein and talking about LGBTQ youth, there was a July 2021 Trevor project that showed that 1 out of 4 LGBTQ youth identify as non-binary, and 1 out of 3 LGBTQ Black youth identify as non-binary or trans, right? So we're starting to see that folks are saying, we're not going to identify with the gender binary, we're going to identify with something outside of that. And again, this is not something that is new. This may be new to some of us in the room, but this is something that people have been identifying as non-binary for a very, very long time, but they now feel empowered to claim that. We know that trans folks are not new at all, but what we're trying to do is create a world where more queer youth feel empowered and feel able to really identify as their full self. You can go to the next slide. So I think I started out by kind of talking and referencing, the huge number of queer and anti-queer and anti-trans legislation. We know that when 2021, we saw there was this huge increase of anti-queer legislation from so many topics, whether it was, trans youth in sports, whether it was just anything attacking our queer life, healthcare, especially for trans and non-binary folks was under attack. I mean, just any way that folks can think of, they were attacking our community. And so 2021 was a record year. It was supposed to be the worst year, for rights in recent memory that affected our community. But then 2022 came, and we unfortunately saw an even larger increase, in even more legislation. And then if you go to the next slide, we are 3 months into 2023. It still feels very new to even say 2023, but unfortunately, it's not new to say that we are tracking an unprecedented number of anti-LGBTQ plus bills within the US. We will drop the link to the to ACLU's tracker, and their current tracker as of yesterday sat at 408. And the reason why I wanted to bring this up is really because it is so important to know if you're trying to do work within our community, that you understand what we're dealing with on a day-to-day basis. As we saw, we're having more folks feeling empowered to be themselves. And unfortunately, we're seeing an unprecedented amount of pushback within legislatures around the country. And so these bills, they continue to target our rights, our life, from transgender health to trans youth in sports to even drag shows. We know that a lot of this legislation is specifically targeting trans folks, especially trans young people. And it just really emphasizes how important it is for us to be loud, to be vocal, to be unapologetic in our support of queer and trans communities. I also wanted to note, because it's not all doom and gloom, right? It does look bad, but I wanted to just go back, and really just reference last year, 2022, because of the efforts of legislatures and advocates. We know that less than 10% of the anti-queer discriminatory bills that were introduced actually passed. So the percentage is around 9% of those bills that were passed. That's still too much. Any amount of legislation that is attacking our community is too much. But I did want to say, as we continue to be loud, as we continue to be vocal, we know that we can directly have an impact on the amount of queer legislation that gets passed. And now I'm going to turn it over to Noel, who's really going to take a spotlight and a magnifying glass to see what's going on in your state, New York.
Hello, everyone. Just real quickly, I missed out on my introduction in the beginning. So I'm Noel, use he, him, his pronouns, also located near Detroit, like Hafsa, and I'm just a project manager. I'm working on our Networking to Save grant, which is our CDC funding to do training and technical assistance to state health departments and many, many organizations across the US with Bryce and Hafsa. So if you go to the next slide, we're going to show a little bit of information about New York. So this data is a little bit old. It's from the Williams Institute, which is a great resource on tracking LGBTQ health data throughout the US. This is from 2021. So it's really showing the distribution of the adult LGBTQ population in the US. And of course, New York is a state with a higher LGBTQ population, so around 5.1%. And if you go to the next slide, here's some information about what are some characteristics of LGBTQ plus folks in the state of New York. And we can see there are some socioeconomic indicators that are similar and some that are different. For example, LGBTQ folks are more likely to be food insecure and live in poverty or have lower incomes than non-LGBTQ New Yorkers. And also when you look at characteristics of folks, going back to what Bryce said about BIPOC communities, in New York, about 41% of LGBTQ communities are BIPOC. So that actually is pretty high, higher than we normally see with a lot of states. So just kind of keep that in mind. And then finally, just another quick stat to kind of throw at you to look at racial equity and queer health equity. If you go to the next slide, in 2017, there was a large survey of LGBTQ residents living in New York metro area. Sort of wanted to assess social and economic community barriers. And we found that overall, 18% of the respondents have experienced homelessness. But when you look at Hispanic, Black, and Asian respondents, they experience homelessness at a much higher rate. These are LGBTQ identified individuals. So 40%, 27%, and then again, 23% respectively. So just to kind of show, there's some challenges and there's some things that we're growing and changing. So if you go to the next slide, I'm going to talk a little bit about data collection because one of the challenges that we have in talking about our community is we are lacking data. So if you go to the next slide, so data is really at its core an equity issue. If data is not disaggregated, if we can't understand or see the health disparities, our communities are going to suffer. So accurate data is really necessary, again, when we think about writing competitive proposals, getting justifying new programming, collecting what we call SOGI or sexual orientation and gender identity data is crucial. So we always recommend, and Bryce will talk more about this at the end around what can we all do to improve queer health, and a lot of it is collecting demographic data, asking those questions about sexual orientation and gender identity anytime you ask general demographic questions, whether it's in programs, whether it's research, whether it's health records or the EHR. So if you go to the next slide, I'm going to talk a little bit about the BFRSS. So that's Behavioral Risk Factor Surveillance Survey. It's one of actually the best places that we can collect population level data on LGBTQ plus communities right now. And so the role of these surveillance systems like BRFIS becomes even more critical in assessing health disparities. So there's a sexual and gender minority SGM, SGM standard measure. And so one of the great things about having these BRFIS data is that we can pool or aggregate data across multiple states. So in 2022, I think we had about 43 states that were collecting sexual orientation and gender identity data. So that's, if you go to the next slide, I'm gonna say we have, so in the last year and a half or so, the National Academies of Science, Engineering, and Medicine released this NIH commissioned report about, it's a consensus study about the best ways to collect data on sex, sexual orientation, gender identity, and intersex status. across kind of all domains like clinical settings, population surveys, administrative forms. So I've included an appendix at the end of this slide deck. We will certainly share these slides, make sure we get them to the organizers to send out to all of you, which shows some of the best practices from this NASM report about how to ask some of these sexual orientation and gender identity questions. But again, we want to encourage that it should be standard practice anywhere that demographic data is collected. And ultimately, that's one of the most important things that came out of this report, is the importance and standardization that's needed around SOGI data collection. So I think we have the link to the NASM report. If not, Hafsa can drop it in the chat, but we can also share that with all of you afterwards. So I'm going to transition now and to talk a little bit about health disparities. So if you go to the next slide. So when it comes to health disparities within the community, it's not because LGBTQ people are bad at making decisions or because our bodies are some way inherently different, but there are systematic inequalities and prejudices that folks have to navigate. Of course, that again, that cisgender and heterosexual communities do not. So something routine as checking in at a reception desk can really wreak havoc for some members of our community. So we are going to actually show a video. We have a couple videos to show in this process of LGBTQ cancer survivors talking about some of their experiences. So this is Caroline. Caroline was a participant in our OUT survey. So this survey was one of the largest LGBTQ cancer survivor surveys done in the US. And so in this clip, Caroline shares some of her experiences as a transgender woman going into a healthcare facility to get treatment. So let's watch and listen to Caroline's story.
But having to go into the cancer center, I'm in Indianapolis, and experience the process was really daunting because here I am, I'm now presenting as female, and at every step of the way, they're going through the motions of the legal name on the insurance forms and going to register. So by the time when I go to see my oncologist, the standard procedure is I have to go to registration desk to check in, then check in at radiology, then talk to the CAT scan person. All right, and they give me the CAT scan, and then back upstairs to get my blood work taken, and then to register at the doctor's office and then get my blood work taken. So there's five or six people that I interact with before I get to my oncologist. They dead name me every time. They misgender me every time. They give me the look every time. And typically speaking, one of those six is a positive experience. The nurses that do the blood work are the only ones that are really cool. And which makes me feel like what we're experiencing is that the doctors and the nurses have gotten some great training, right? But the administrative staff, right? The people who run the check-in desks, the people who can go through and make sure all of the financing is done and everything like that in radiology aren't getting it.
Okay, so, as this day in the life kind of clip from Caroline demonstrates, it's important that all levels of care, from the receptionist to the CAT scan technician to the oncologist, that everyone's been trained to kind of make sure that the care is welcoming, safe, and respectful. And we wanted to open with this clip just to kind of frame, and we'll talk more detail later about some of the actions that people can take. But we just kind of wanted to frame a little bit about what the community experiences. So if we go to the next slide, we're going to talk a little bit about health disparities. So there are physical health disparities that LGBTQ folks face. And as the slide details, LGBTQ people are at risk for certain diseases and conditions. We have higher rates of HPV infection and related cervical cancers, higher rates of anal cancer. Lesbian and bisexual women, for example, again, are showing higher rates of breast cancer. And then on the other end of the spectrum, older LGBTQ adults are more likely to have their health, to rate their health as poor, have more chronic conditions, have less social support. So those are some of the physical health disparities that we're seeing. If you go to the next slide, there are a lot of behavioral health disparities. So we know LGBTQ people are at greater risk of suicide, suicidal thoughts, anxiety, eating disorders, alcohol and substance use disorders. Really, research is showing that LGBTQ populations of all ages are disproportionately experiencing many of these mental health and substance use issues. And again, this issue is even larger or greater in BIPOC communities. So for example, Black LGBTQ people experience higher rates of discrimination and stigma due to having one or more than one marginalized identity, including racial identity, sexual orientation, gender identity. And so the mental health impacts of these experiences is huge. A growing body of research is really kind of showing that the impacts of discrimination. There's a recent study that showed like 95% of Black LGBTQ folks reported discrimination was negatively impacting their psychological well-being and mental health. And then again, looking at the next slide is thinking about access to care. So there are a lot of health disparities related to access to care. So LGBTQ folks are much less likely to have health insurance. If we have health insurance, we're less likely to use the health insurance, less likely to have a primary care provider, more likely to delay care. This is especially relevant when we start talking about cancer screenings. And then again, more likely to report poor quality of care. And so if you go to the next slide, we have to shout out tobacco. Again, a lot of the work we do is around cancer, but also tobacco. So we just like to kind of throw in a slide about, again, LGBTQ folks are much more likely to smoke than cisgender and straight communities. We smoke more than the general population. We use menthol tobacco products more than non-LGBTQ people. We're again exposed to secondhand smoke at higher rates. And we also see more tobacco product ads than non-LGBTQ people. And we know that a big issue is targeting, again, from the tobacco industry. And so then let me talk a little bit specifically about cancer in LGBTQ communities. So what do we know? And again, there are limitations to the information that we do know because of the lack of data collection, but more and more research is coming out. So while there are challenges, again, national cancer registries don't routinely collect this info. We do have some information. So lesbian and bi women might be at an increased risk for cervical cancer compared to heterosexual women. Again, lesbian and bi women are less likely to receive like cervical cancer screenings than heterosexual women, about 25% less likely. And we think about cervical cancer screening in the trans community. We know transgender men are much less likely to be current on cervical cancer screenings than non-transgender women. And so if you go to the next slide, we also are talking a little bit more about colorectal cancer too. Those screening rates are significantly lower again in LGBTQ communities, but we do see a slightly higher incidence, prevalence, and mortality for queer communities. Some of that is probably driven by the fact that we have a lot of risk factors that are correlated with colorectal cancer, like increased tobacco use and alcohol consumption. And then the other thing we want to also talk about is anal cancer. It's not something that is talked about enough, but in gay and bi male communities and trans communities, there's, again, found 20 times more likely to be diagnosed with anal cancer. So that's something that as an organization, we're working on providing not only provider education, especially to primary care providers to have those conversations with their patients, but again, encouraging community education and patients to kind of, how do you talk about that with your provider? How do you bring up, am I a good candidate for an anal pap smear and things like that? So if you go to the next slide. Okay, so we are going to talk about Paula. So again, another video, Paula, at the network, we have a resource which is called a microsite called Sex After Cancer. And we call the site Frankly. I'm going to talk a little bit about sex and sexuality when I talk about some survivorship issues. But here Paula is sharing her story about how being an out proud lesbian was actually a detriment to her receiving cancer care. So let's listen to what Paula has to say.
I've always been very out. It just behooved me, and it was better for me to just let people know if something's wrong, you're gonna have to talk to this person, whether you want to or not. Now, I once had a doctor in Harris Health. He was a very learned man, but he sat me down and told me straight up, I think you're wrong, and I think you're going to hell, and I can't treat you. And I said, I thank you for telling me that. I don't want you to treat me. So we're, and I'm not sure he was supposed to tell me that at all, but he felt confident enough to tell me that right there in the office of Harris Health. So I would have people tell me when I would say I was in pain, especially with this colorectal cancer, when the pain would first start. I'd have people telling me things like, oh, I had one doctor tell me, well, you people usually can take pain. Come on, toughen up. Ha ha ha. Just blatantly inappropriate things, but always with a joke or something, and you just, unfortunately, you kind of get used to it. It's sad, but true.
So, I mean, I still am blown away by this, and it's this, Paula was talking about her experience with an oncologist that happened in 2021, where she was told, by that provider that he wasn't going to treat her because she was there with her partner. So while we're certainly glad that Paula pulled through, her healthcare journey, hasn't been easy. And you can read more about Paula's experience with colorectal cancer and sort of the struggle of being on public insurance and being a Black lesbian, how that's impacted her care on Frankly. So I think Hafsa or Bryce can drop a link in the chat for the Frankly microsite if people want to read more about Paula's story. So I'm going to talk a little bit now about barriers to cancer screening and prevention. Oh, I'm not going to talk about that. Wait a minute. We've got a poll for you all. So let me actually turn it over to Hafsa. We're going to pause and do a quick poll. Okay, so yeah, we wanted to ask people, as I kind of talked about some of the challenges that that we're seeing across the country for cancer survivors, we're wondering if any folks or what work you have or experiences you may have, what kind of cancer health disparities are you seeing in LGBTQ communities in New York? Are you seeing any of these same issues that we're talking about? And so you can always go to menti.com and use the same code, or Hafsa's going to drop a link in the chat. And we'll give people a minute or two to add some responses. So as things come in, I might read some of these out. It sounds like some of these are similar. People are mentioning fear, again, fear of attending appointments, fear of screenings, medical mistrust, lack of data, stigma, lack of insurance, screening, lack of follow-up due to misgendering. So if someone does go in for a cancer screening and has a negative experience, maybe they're much less likely to follow up, much less likely to engage with the healthcare system. And I don't know if you can scroll a little bit, Hafsa. Yeah, a lot of medical mistrust, data collection, and prior healthcare trauma. I really appreciate somebody who brought that up, because a lot of times, I mean, I really will say, LGBTQ communities, the medical discrimination, the stigma, it really is a community level trauma. So even if you haven't experienced it yourself, people that have, and you are just kind of waiting for it when you go into a medical interaction. So thank you all for sharing those, some of the things that you're seeing in your communities. And I see a lot of data, lack of data collection as well. More medical mistrust, and not having opportunity or not being asked about your sexual orientation or gender identity. Exactly. Okay. So I'm going to talk in one last section before I turn it over to Bryce to kind of take us home and talk about, well, what are some of the solutions? But I'm going to share one final section with you all about barriers to screening and cancer care. So if you go to the next slide, sort of compounding the problem of health disparities in LGBT community is this like tenuous relationship again with the healthcare system. So we know LGBTQ people are much less likely to have insurance than our heterosexual counterparts or be underinsured. Transgender folks have the lowest insurance rates of all groups. And again, studies have shown that, I mentioned this before briefly, but women, particularly lesbian women or bisexual women, are much less likely to have a primary care provider or a regular source of healthcare. So looking at kind of like using primary or using urgent care or emergency rooms more often. So for LGBT people with health insurance, kind of gaining access to appropriate care can still pose difficulties. For example, like a transgender individual may not be covered for any procedure or cancer screenings because there might be an inconsistency with the gender marker on their insurance card versus their legal documents. So for example, like a transgender man who needs to get a pap smear who still has intact cervix. So along with other challenges with health insurance, LGBT people are less likely to have a primary care provider, and that can be a big issue when we need to make referrals for cancer screenings. And then finally, like systemic discrimination has really contributed to these communities having higher rates of poverty, and we talk about financial instability. And then again, this is just kind of compounded when we think about folks being from multiple different marginalized identity groups. So if you go to the next slide. So why are LGBTQ people underscreened? So a couple different factors there. Again, we experience discrimination in healthcare settings or fear of discrimination, and that fear discourages people from, again, seeking care. And LGBTQ people may have trouble finding alternative services if they're turned away. A lack of knowledge with regard to cancer screenings and cancer screening guidelines on the behalf of providers. So there's another appendix in this slide deck that has some referrals. One of the questions we often get asked are, well, what are cancer screening guidelines for transgender individuals? So we have some resources and places that we send people in an appendix there. So that might be helpful. So again, like for example, gender identity expression and dysphoria is a big issue. So sort of gendered language, gendered cancer screening can really exacerbate this issue. So just as an example, if you see in the images, this is Vermont's breast and cervical cancer screening program, just an example of their program. So they used to be called Ladies First. And that wasn't very gender inclusive for the full range of people that might utilize these services. So they updated their logo and are now called You First Screening and Support. So I think that that's just kind of one example of the things that Bryce is going to talk about, some more about changes we can make. And then a little bit, the next slide. I'm going to talk briefly some barriers to cancer care. I did reference out the National Cancer Survey. We can drop a link to our report on the cancer survey, but in 2020, we launched this survey. Again, it's the largest ever of LGBTQI cancer survivors. We have over 2,700 folks with a cancer experience who responded. And again, we published 3 different reports, one focused on BIPOC communities, one focused on transgender communities. And something we heard again and again from those surveys is that there's just like no clear indication that the healthcare setting that they were going into or receiving care was welcoming. So this is a big challenge when you go into a cancer center. Only 12% of people saw some sort of indication that the cancer center was going to be LGBTQ friendly. And if you go to the next slide, we just threw a couple of quotes up here just to kind of further let you know about the LGBTQ cancer experience. So compared to cisgender survivors, gender expansive or trans folks are 2 times as likely to not disclose their identity to providers. And among those who disclose their identity, they're 3 times as likely to report care being less welcoming. So a couple of quotes, these are especially from transgender cancer survivors. I didn't want to piss off the person who was treating me. I was scared of speaking up for myself about my orientation and gender identity. And then during cancer, I was stressed enough and didn't have the energy or time to inform people or correct people about my identity or orientation. And so if you go to the next slide, as we sort of move into this last section, one of the things that we found in our data analysis, and this shouldn't be shocking, but I think it's something that's nice to see, participants who rated their providers as very welcoming were almost 7 times as likely to report, again, being very satisfied with their cancer care. And when we think about what that means for improved outcomes, people are adhering to their treatment regimens, and there's all kinds of things that can really impact, being satisfied with your cancer care that can really impact your treatment outcomes. And so finally, I know you all wanted me to talk a little bit about cancer survivorship. So one last slide before I turn it back over to Bryce. What are some LGBTQ kind of cancer survivorship issues? And these are the things that at the network, we kind of talk about, once diagnosed with cancer, queer people do face some unique challenges. First, people have to decide if they're comfortable coming out to their oncologist and treatment team. So even people who are generally comfortable in revealing their sexual orientation or gender identity in regular patient-provider interactions have trouble revealing it to an oncologist. And we've done some, qualitative surveys and research, and a lot of that is driven by people are just so scared. Cancer feels like a life or death thing, and they're just more fearful of alienating a provider when there's a life-threatening illness like cancer. Again, family support. So this is a big issue. So family support is critical for cancer survivors, and queer people, again, we know, create families that are often invisible or unwelcome in some healthcare settings. So intake forms might only ask about a legal married status. Providers might not know who to invite to the office for meetings, or might not include partners or even recognize them when they're there. Quality of life, particularly around sex and sexuality. So a lot of cancer treatments, of course, affect sexual functioning, but oncologists and social workers sometimes don't address the impact on LGBTQ sexuality adequately. So for example, after treatment for prostate cancer, one of the most common cancers diagnosed, in men or cisgender men, the experts often say that, oh, most men can still have an erection good enough for intercourse, but this is not necessarily a meaningful measure, for example, for a gay man that requires, a stronger erection for anal sex, or he needs to know, like, can I have safe reciprocal anal sex? And even when the patient is brave enough to ask those questions, the oncologist is often sort of ill-equipped to answer those. And then finally, support groups. We see this a lot, which is why we created some LGBTQ specific support groups. But they pose extra issues. A lot of times folks don't feel safe in support groups, particularly if they're caregiver support groups. So for like a partner of a woman, a lesbian breast cancer survivor, would probably be the only woman in her caregiver support group. And the same thing for a gay male partner of a prostate cancer survivor seeking support might be the only man in a caregiver support group. So this kind of diminishes the likelihood of receiving that knowledge and that support for survivors. Okay, so I'm going to turn it over to Bryce so we can talk about what we can do about all of these challenges.
Absolutely. So I never like to have a presentation, especially when we're introducing a lot of data and a lot of folks' stories and a lot of just what we've been hearing from our community. We never want to just present all of that information and then not leave you with tangible action items that you can do to address any of the cancer barriers in reference to our community. Also been seeing a lot of questions in the chat. I think between Hafsa and I, we've been trying to answer them. I also been trying to collect all of them, so at the end, if we didn't get to your question, that we can then get to it in the Q&A. Thank you all so much. All are one of the most engaged folks that we've seen in presentations. We love to see a lot of questions. We love to see a lot of discussion. And so really talking about and starting up on these winning strategies before we can really talk about creating supportive and affirming environments, for folks, we first like to start by talking about your own organization. So many folks look at, how can we, partner with this queer organization? How can we, start doing work within the queer community in our state or within our area? And we're like, well, have you first looked at that within your own organization? And so do you have queer staff? Do they feel valued? Do they feel seen? Because a lot of times you can't even start to really address the community or, you know, queer folks in your community or in your state if you're not first looking at your own organization. So we know that in 2021, this is from Boston Consulting Group, BCG, and also New York's lesbian, gay, bisexual, and transgender community surveyed about 2,000 LGBTQ employees and also 2,000 non-LGBTQ employees across the US. And so the goal of that survey was really to understand the experiences of today's queer workforce and also how companies can create more inclusive environments. And so you see in the bullet points there some of the results of this. We know that employees who are experiencing more negative touch points, they're 40% less productive and about 13 times more likely to quit a job. We know that so many of our folks don't feel safe within their workplaces. And if you don't feel safe within your workplace, it's going to be a barrier to your success there. It's going to be a barrier where you don't even feel psychologically safe. And so, you know, it's really important that we talk about how folks, you know, what we can do within workplaces to make queer folks, you know, feel included and feel welcomed. You can go to the next slide. Along this section, we're going to be talking about some really great programs and initiatives that we have at the National LGBT Cancer Network. I think Noel will be dropping those links in the chat. One of our newer programs is Cancer Leaders Like Us. It's a mentorship program that's really trying to provide opportunities for LGBTQ plus folks and BIPOC communities. It's such a amazing program. I'm really excited to watch as it grows. It was just launched kind of in the second half of 2022. And this mentorship program, it's completely free. And it's really focused on supporting queer folks and BIPOC folks who are undergrads or graduates or early career professionals who are open to working in cancer inclusion as a career. One of my favorite things that Cancer Leaders Like Us does is each month they host career talks, and the special guest for their March career talk is Colin Burnett, who's a current medical student at the T.H. Chan School of Medicine at the University of Massachusetts. He actually broke through a lot of the noise and created media attention and recognition for his research on LGBTQ cancer and survivorship. And you know, that data from our, you know, he like phenomenally was able to quote and use data from our OUT survey, which is our national cancer survey that we launched in 2020. It's one of the largest ever studies of LGBTQI plus people within cancer. And so we'll also drop a link in the chat for you in case you want to learn more about Cancer Leaders Like Us, and in case you want to register for that career talk. Hafsa's on it. Thank you so much for doing that. Hafsa's been amazing at sharing those links in the chat. You can go to the next slide. So another one, so, you know, that was one of our best and promising practices that really talked about looking within your own organization. Another one really talks about focusing on engaging with members of our community. Engaging community members is not always easy, right? We hear so much, like it's hard to get people on our coalitions. It's hard to get people motivated and activated. And that's totally understand. I think something that has not been said enough is we are living in times that are really, really difficult and exhausting for all of us. But it's really, really important that when you're looking at engaging community members, that the intervention, the education, the outreach that you're doing is really tailored to, you know, your community on a local level. And so we'll take your state in New York State. You all have a you know, very diverse group of folks who live within the state of New York. What is happening in New York City is not happening in other parts of New York. And so it's really important that, as you're like engaging with our community members, we have heard time and time again, well, some of these, sites and some of these resources are really great, but we can't use them within rural communities for queer folks, or we can't use them in this part of the state or this part of, the city. And so it's really important that you are looking at how you can tailor your information to communities on local levels. And so one way to do this is really including queer community members on advisory boards or coalitions. A really great example of this is Equitas Health in Ohio. They're using queer community members in educational campaigns and training community volunteers to assist with their outreach. Something else that's highlighted on this slide is Austin Public Health, located in Texas. We know Texas, it has been a state that has not been very friendly to our community, especially as of late with all of the anti-queer and trans legislation coming out of there. But we're so proud of programs like Austin Public Health, who are launching, queer advisory boards, and they actually have a queer coalition that just met yesterday, where they're really looking at how they can really engage and do work within tobacco control for the queer community. You can go to the next slide. Talking about how we can make cancer screening relevant, it's really important that we understand that a lot of times our cancer screening is just not a priority for our community. I saw, some folks asking about, why are there high rates of breast cancer, specifically within lesbian and bisexual women, and what the best response is really that, so often our community does not prioritize cancer screenings. And that has been, especially true as of late within the last few years. When we saw, we went through the COVID-19 pandemic, we're still going through it, we're still in the midst of it. We know that especially hit our community even harder. And so it was really, it can be really difficult for just us within a community, because we have so many things that we're dealing with, so many things that are a focus that have gone ignored for so long, that it's really, it's really common that we don't focus on our own health and that we don't get the screenings that we need, because so often we are fighting for our literal right to exist, to make our community safe. We're fighting to receive affirming and welcoming care. We're fighting to have access to that, our folks can use the restroom of their choosing. And so when we're fighting for basic human rights, it can be very difficult for us to also remember, hey, we've got to focus on our own healthcare. We've got to focus on the screenings that are going to be used to protect us. And so we always address meeting the community where it's at, starting from that place of health equity. We can't do any work within healthcare, within public health, without talking about health equity work. It's also important that we address social determinants of health and any other factors that are contributing to disparities within our community. You can go to the next slide. We know that cancer services and screening programs and healthcare centers really need to go out of their way to show that they are visible, to show that they are welcoming. We know that our community members are looking for any indication that this is a safe and welcoming space. I just turn into this grade A investigator, when I'm looking for a provider, whether that be for mental health reasons, whether that be for primary care, whatever, dentistry. I'm always looking at, oh my goodness, I'm both Black and queer, and I also live in Mississippi. And it's very, common that a lot of the providers that I may interact with are not very welcoming to myself, are not very welcoming to the trans folks here in our state, to the non-binary folks here within our state. So anything I can do, whether it's on websites, whether it's on community brochures, anywhere I'm looking at, okay, how is this going to be a safe space for me as a queer man, but also talking about that intersectionality, me as a Black man too. And so one way to really build that welcome is to have space within your website, as you see some examples here, that has resources, that has information that are really tailored to our community. I know that I'm going to talk about this kind of in the next couple slides, but we love seeing tailored images. We love seeing tailored materials. We love to see ourselves be represented. It's so important that we see images of ourselves being represented, so that we know that this place that we're potentially going to for our healthcare is going to be welcoming, but also so that we know that queer children are watching. They are seeing how we're talking about queer folks. They are seeing the kind of tailored information that comes out, and that can make a difference in whether or not they feel safe to be able to come out in their own time. Both the Cleveland Clinic in Ohio and Henry Ford Health Center in Detroit, they actually have space on their sites to address LGBTQ community needs and also share non-discrimination policies. You can go to the next slide. As we continue to talk about building welcoming environments that are inclusive, I'm going to kind of barrel us through some of these slides. But again, you are going to get all of these slides along with the links that we reference. We will make sure that that everyone receives that via their email. Building welcoming also means addressing the language and how we name things. And so how could this be made more welcoming? When we look at, for example, the Dana-Farber Cancer Institute, and it says Women's Cancer Treatment Center. And so if we're talking about, for example, breast cancer, right? It's really good of us to start saying breast and chest cancer, because we know that there are folks who do not identify as having breasts, or really don't identify as being women, who also have breast and chest cancer, right? And so it's really important that we look at how, what are the terms that we use that we're using. If a trans guy had to walk into a place where they're saying Women's Cancer Treatment Center, he's not going to feel accepted. He's not going to feel included. And so it's really important that we're looking at the terminology that we're using. Going to the next slide, that really continues with a really great example on the next slide of a visible sign of queer welcoming. And it has this rainbow flag that's on social media, really indicating that this program is going to be queer inclusive. This is something that if I'm like doing research and I notice, oh my goodness, this program has like a logo where they're, where I'm seeing a rainbow or anything that's showing that they're going to be queer inclusive, I'm like, sign me up. That's the program that I want to go to. And so if you notice, they're using the Progress Pride flag, which combines the rainbow flag, the trans flag, and also Black and brown stripes to celebrate queer BIPOC folks. You can go to the next slide. Kind of more on language and terminology. We know language is so important. And so in this image, you'll see some info from Vermont's You First program. And so instead of saying women, they said like, you have or had breasts or cervix. We really want to stress that it's important to ask about the language the client uses to refer to their own body parts and to just mirror that language. If someone says my front hole, then that's really great language to then mirror back to them rather than saying something else. And so please also ask about people's pronouns and the pronouns that they use. Some folks say that they feel a little bit uncomfortable doing this. A really great way to do this is by modeling yours. Hi, my name is Bryce. I use he, him pronouns. And then having that person then respond, I'm so-and-so, and I use, she, her pronouns. And so it's really great to start to model that. You can go to the next slide. The next slide includes a whole bunch of ways that organizations and health systems have shown that they are welcoming and inclusive of our community, changing logos during Pride Month, hosting events, webinars, larger scale visibility displays like lighting up buildings, which is really great and it's amazing. I also just want to remind you that you should be doing work with, if you care about our community, that you make sure that you're doing work within our community year round and not just right before or during Pride Month. You can go to the next slide. We know that the physical office or clinic location is also a really great way to show welcoming. Some of these examples include, being mindful of the gendered signs that are being used, like we talked about, women's clinic, or some of those gendered colors. Labeling single stall restrooms as gender neutral or all gender is also a really great way. Displaying pronouns on staff badges, varying your magazine choice and representation in brochures, all of them are really, really good. You can go to the next slide. So one of my favorite programs that we have at the National LGBT Cancer Network is Welcoming Spaces. It's the result of over a year's worth of collaboration between expert physicians, expert psychologists, researchers, educators, and trainers, and patient advocates from across the US. And so it is our new LGBTQ plus cultural humility trainings that are really designed for anyone who works in the healthcare system. It was developed in collaboration with the Society of Gynecologic Oncology. The trainings feature 8 free online modules that are each about 45 minutes and that are also available for those CE credits, which if you need those, definitely a phenomenal program to take. If you don't need them, also a phenomenal program to take. We know it is so important that we continue being lifelong learners, that we continue to be updated about what's going on and making sure that we're inclusive and that we're encouraging welcoming environments. Welcoming Spaces is one of the best programs to start to have those conversations. The first module really focuses on those, the basic LGBTQ plus, like an introductory on that terminology. So it kind of talks about what we went through, but even more in depth. As well as tools for breaking down assumptions and developing strategies for really addressing any harmful interactions. There's another module that really talks about social determinants of health. It really goes in even deeper than we went in. And so we always encourage, anytime folks ask me about welcoming spaces, I'm always like, listen, just take the first module, kind of on that terminology, and then you're free to take more modules. You're free to share this with your colleagues and say, hey, look at this great resource that I found. It does say on there that it's free for 2022. It's also free right now in 2023. So I think the link has already been dropped in the chat. And so feel free to check that out and to, even give us feedback on how that is going. All modules are available. We encourage folks that are working within public health and healthcare to take the first 5. The last 3 modules are specifically for folks who are oncologists. You can go to the next slide. So we also encourage organizations that we work with to collect representative data on LGBTQ plus issues. I cannot stress the importance of collecting SOGI data, SOGI, sexual orientation and gender identity data, in all places that we collect standard demographics. You've heard myself, you've heard Noel and Hafsa throughout this. We may say LGB or LGBT, and it's because we don't have the data to represent the Q plus community sometimes, or we only have data to represent LGBTQ and not, expansive queer community as a whole. So it's really important that we're focused on collecting that social data in all places. Another place that we can collect that information is through program registration and participation through electronic health records. So these are some really great examples of that. And another part of collecting program or health record data is to really educate patients and program participation on why we're asking. We ask because we care. It's a really great example of one of those campaigns. You can go to the next slide. And so working with local community members and organizations really ensures that your outreach, that your messaging, that your program activities are really tailored to the local needs of community members within your state, within your region. Iowa Cancer Consortium, One Iowa, which is a statewide LGBTQ plus organization, and Iowa Department of Health and Human Services, they all work very closely together to meet the needs of trans and non-binary communities. And so this slide really features a really great example of that social media outreach. Another excellent example of a partnership is the Vermont Department of Health and the Vermont Pride Center. There's an image from their Got It, Screen It campaign. You can go to the next slide. We are not going to show the video on this side just in reference for time. Again, we're going to share these slides out so that you are able to watch that video within your own time. You can go to the next slide, and actually you can go to the next slide after that. You can go to the next slide. Another important strategy is to build up your resource repository. You can do this by collecting great resources from other programs. Sometimes, even a lot of programs will allow co-brandable material, so that you can add your own logo, your own organization's logo. A really great example of a resource is the Equitas Health Institute Breast Chest Health Guide, which is really focusing on providing our community with information on breast and chest cancer and those screenings, as well as tailored information to help queer and trans people who may be hesitant about getting screened. And so Hafsa was able to drop that link in the chat, so feel free to look through that. Maybe it can give your organization some ideas. You can go to the next slide. I told you that we were going to be just along the way talking about the really great programs that we have at the network. And another one that has recently launched is Queer Health is Power. So Hafsa is going to drop that link in the chat. I'm so excited because we, anytime that we refer to this program, we're just like, hey, this is a program, this is a resource, you can stay tuned to learn more. But we're actually talking to folks within the state that this program is actually for. And so we have a new grant that's with the New York Health and Human Services called Queer Health is Power. The major goals of the project are to partner with New York State LGBTQ plus service organizations to create a statewide health promotion social media campaign that is related to cancer risk for our community, prevention, screenings, welcoming healthcare centers. The project is also going to survey free and low-cost cancer screening sites. I saw some questions about that in the chat to evaluate their level of queer welcoming. And along the way, our staff is also going to be working on a project that's going to be providing training and technical assistance to those organizations, and also updating our own provider directory with welcoming providers in New York State. And so the project is already underway in Manhattan. Stay tuned to our newsletters and also stay up to date with the project. And if you want to get involved, I think House is already on it. You can contact our project manager who's over that grant, Harold Abrams. You can go to the next slide. So our final best and promising practice is that whenever you are collecting information from our community, for example, a local health needs assessment, make sure that information is disseminated back to the community. These are really great examples from Hawaii and also Vermont. You can go to the next slide. So some of these are some examples that I'm going to kind of skip through so that we can get on to just ask maybe 1 or 2 questions from you all. But we know that Iowa Health and Human Services, they've been working closely with One Iowa, which is a leading statewide LGBTQ plus equality organization in Iowa. One Iowa partners with their Department of Public Health to really connect, those queer Iowans, particularly older queer women or trans individuals, to their cancer screening programs. And so the Care for Yourself program has local staff that help you to schedule clinical breast and chest exams, mammograms, pelvic exams, pap tests. I mean, the list continues. So we love to see that work is going on in Iowa and around the country. You can go to the next slide. The next slide features some really great examples of addressing screening disparities for our community. The left image is around any breast cancer risk factors, especially for folks who identify as lesbian. The right image is a chart for trans men to uncover what types of screenings that they need. Love the program. If you've got it, check it. That's really meant to be inclusive. And then kind of the last slide to kind of close us out, Iowa's Health and Human Services, they've also updated their breast and cervical cancer screening logos to be more inclusive. So the logo on the left-hand side has a more feminine shape and doesn't really showcase all of the program services. And then the updated logo, the Care for Yourself, includes non-gendered and gender inclusive language. And so you can go ahead and go to the next slide. We're going to skip any more polls that we are going to do, but we do want to take maybe 1 or 2 questions from you all. I was trying to gather some of those questions within the chat. You all are like so active in the comments, and we love that. So I'm just going to answer a couple of the questions in the chat before I turn it back over to the amazing organizers of this webinar, so that we can close out and get you on to the rest of your day. So a question about preferring to broader groups of people and using gender diverse, that terminology when really talking about all folks. I think that's a really great way, especially, to really talk about all folks in the room. That's a really great example. I saw another question asked about if it was okay to call people by their name, and just kind of avoid using pronouns. I'm gonna go ahead and say it. If you are only using my name with me, right, I'm gonna quickly know that you don't feel comfortable, right, with pronouns or different things like that. Because if you have, just imagine if folks, like, every time they reference your name, they are, doing it without saying he, she, they, etc. It's very noticeable. So again, there's nothing wrong. It's actually great practice to ask folks, what pronouns do you identify with, just to make sure that you are being inclusive. And so I think I hit on some of the questions already that folks were asking in the chat, but feel free to continue to drop those questions. We're happy to answer them via email. And also we will definitely feel free to send out all of our slides with the links attached. Thank you all so much for having us. New York State, you were an amazing group of folks that we were so lucky to get a chance to spend a little time with you today. I'm going to turn it back over to the amazing organizers.
Thank you so much. This has been so informative and lively, and I love all the interaction and the great questions. And I think it's just been, for me, so good to kind of think about things outside of the box from the traditional way we're thinking about things, and it's just great to have these new avenues. We do briefly have a quick poll. We have a poll, sorry. Just a quick poll for everybody, if you can, before you hop off, if you can just kind of quickly select your choices so we can get a sense of what kind of programming we're bringing, who we have here today. So if you can quickly select your choices. And I'm so thankful for the whole team for bringing this great content to us. So thank you, everybody, for sure. It's all great. And I know we're going to collect the chat links and all the resources. I've been opening windows as I've been listening, just because I'm going to go back and look at them all myself, but just for sure, so everybody can grab those if they weren't able to attend or if they missed some things.
And again, I will make sure to share the slides, and I know some people were asking
Thank
about
you.
references as well. So those, we'll make sure those are all linked in the slides, and we'll send those out to be shared with the group. So. And I also dropped Bryce and I our email addresses. It's just noel@cancer-network.org or Bryce@cancer-network.org. So feel free to email us, about any questions you might have, or any work that you want to do in this area. We can also connect you with our colleague, Harold, who is leading the Queer Health is Power project.
Awesome. Well, thanks again, everybody, for your attendance today. We really appreciate everyone's time and their passion and dedication to these topics. So hope to see you again at another quarterly meeting. And I hope that we can find other ways to interact between our group and yours from the consortium standpoint. So thank you again.
Bye, everyone.
Thank you.
Take
Bye.
care.